When is it really a good time to consider getting hip replacement surgery? When would I actually do it for myself? And would I get any other kind of arthroscopic hip surgery? In this video, we're going to talk about one really stunning case that made me rethink everything about hip surgery. I'm Matt Shu from Upright Health, where we help you think right, move right, and feel right. If you end up liking this video, be sure to click the like button and subscribe to the channel so you don't miss out on any future videos. At Upright Health, we work with a lot of people with hip problems. Our clients have usually been told things that are really fear-inducing. They really scare the daylights out of people. Doctors will tell them, oh, you have FAI, hip impingement, and your bone shapes are so misshapen that only surgery can fix your hip pain problems. They are told that they have arthritis, and because of your arthritis, you need to stop moving. You can't move at all, otherwise you'll make everything worse. All of these types of admonitions and warnings often just make people feel helpless and also make the hip pain feel worse. I've personally been told that I have mild arthritis and that I should stop moving, I should stop doing any sort of martial arts, I should stop doing anything high impact, I should stop trying to lift weights, I should stop doing all kinds of things. But what's really helped me is actually disregarding that noise and learning how to train my body in a safe way and bringing more and more motion in a bigger variety to my body. Of course, doing it in a gradual and safe way. Now, that's not to say I have never considered hip surgery. I have actually considered hip surgery when my hip pain was really, really bad. I used to think, man, there's nothing I can do besides get this surgery, so I really hope it would make things better. But here's the thing. I got an email back in September from somebody that I've never met. She just wants to have a nickname, so we're going to call her the hippie. And she emailed me with this question about hip replacement and whether I thought she should get it. I'm going to read to you the text from this email. She said, I'm 2 weeks away from hip replacement surgery. The problem is I have a collapsed hip joint, but no pain in my hip. It started with doing splits on the ice and then gradually worsened over the years. I lost about an inch of leg length to collapse from avascular necrosis. Okay, so basically what this means is this person has a totally collapsed femoral head. So that means the ball that goes into the socket, that ball has actually crunched down. It's all messed up and is stuck and jammed into the acetabulum. It's jammed into the socket. It's actually completely collapsed. This head of the femur completely collapsed. She can't move that hip joint at all. Basically, her lower back and her pelvis move instead of that hip joint. So her low back ends up hurting. So she asked me if I thought hip replacement made sense at that point, or if trainers at Upright Health might be able to help her. My answer to her was that if it were me, I would probably get the hip replacement because there would be almost no way for muscles to hold the ball and get the ball off of that sharp edge permanently. Just because of the way things are lined up in the body, you've got the weight of the torso coming down into this chunk of femur. Unless you can get the adductors to be super duper strong, and then maybe get the abductors, the side of the hip, to get super strong to somehow hold that head of the femur in place, there's just no hope, right? You constantly have that weight coming down. You have to traction that out. And if that chunk is always missing, if you just rotate the femur just enough, you're always going to fall into that hole. So I said, you know, I don't think you can actually train that out. That looks pretty bad. But here's the thing. You're not going to believe what the surgeons were saying. The doctors told her that they would not do the surgery because she doesn't have any pain in that hip. And the surgeons were all very reluctant to go into a non-painful hip to do a hip replacement. There's two things that are really interesting about this situation. The first is this woman, hippie, had really damaged her femur. That hip joint was very clearly basically destroyed and rotted. The bones were completely collapsed on the femoral head. So if anybody should have pain from bone damage, it should have been her. But what her case illustrates is that damage as we know it in x-rays doesn't actually correlate with the experience of hip pain. This is something we've talked about in other videos where we talk about how arthritis in x-rays has basically no correlation at all to the pain or other range of motion problems. This woman, totally collapsed femoral head, no pain. The second thing that's really interesting here is that the surgeons were telling her, hey, if you don't have pain, we don't want to go in and operate on you. It took her a lot of searching to find a surgeon who would go in to replace that completely collapsed hip joint. The reason the surgeons gave her was basically that the replacement of a joint has risks. There are things that can happen during surgery. There can be side effects. There can be all kinds of issues that crop up as a result of the hip surgery. So if somebody doesn't have pain, they don't want to go in and potentially create pain if, you know, they go in and mess something up, or if there are some unpredictable muscular compensations that happen as a result of the surgery. In short, the surgeons were seeing damage to the bones, not causing pain, and since there was no pain, they figured it's just not worth repairing the damaged joint. This whole situation should make you think really carefully about what bone damage means in terms of hip pain and what surgery can actually do in terms of that pain. So in this case, you had somebody with the worst possible amount of damage to the hip joint and was experiencing no ill effects at all, besides the fact that she couldn't move her hip joint. But she wasn't feeling pain, she wasn't feeling swelling or inflammation. She felt fine, except for her low back was bothering her because of all the compensations she was using to get through her day. When I read her email, I found it really shocking, and we exchanged a few more emails about what she had experienced, and the whole thing made me rethink everything about surgery, because this is one case where I would say, yeah, you should probably get surgery so you can actually move that hip joint more freely than when it's just completely stuck and jammed like that. But at the same time, it made me think, well, that's interesting that surgeons are thinking that the only thing that their hip replacement surgery is good for is relieving pain, and that they don't really want to think about it as something that restores function. That's a really weird perspective for me to wrestle with, because for us, when we're working with people, we're thinking about restoring function as the means of getting rid of pain and other discomfort. Restoring function is the first goal, and as you restore function, things start to get better. In a rare edge case like avascular necrosis, where somebody's bone is collapsed, you can't restore the function unless you have fixed that problem and allowed proper joint motion so that the muscles can work on the femur and pull the femur and move it around without messing with the low back and the pelvis. Again, this story was literally mind-blowing to me, and I shared it at the Healthy Hips workshop that we did in October. Everybody who heard it was pretty flabbergasted, and all the coaches at Upright Health have been pretty shocked to see this story. So I'd like to know what this triggers for you. What kind of thoughts does this make you think about hip surgery and about bone shapes, about bone damage, and about arthritis and all the muscles around your hips? What does this make you think about, and how does it affect your perspective on hip replacements and on hip surgery? I'd be curious to know. Let me know in the comment section down below. If you want to join us for a Healthy Hips workshop, be sure to check out the description box down below, and we'll try to link it up here in the card section in this video on YouTube. The Healthy Hips workshops happen a couple times a year, where we go over how to train your hips in a safe and effective way so you can improve overall mobility and strength. And we try to boil things down into some simple questions you can ask yourself and show you some really key exercises that you can use to start troubleshooting your body. So if you've had some hip function issues and you're trying to help yourself, be sure to check out the Healthy Hips workshop. We've also got a lot of resources on our website at uprighthealth.com/hiphelp, so be sure to check those out as well. And if you like this video, click the like button. If you really didn't like the video, you can click the dislike button 2 times. If you really liked this video, be sure to share it with somebody you know who could benefit from this information and this perspective. Don't forget to subscribe to the channel and click the bell icon so you don't miss out on any future videos. I'm Matt Shu from Upright Health, reminding you that pain sucks. Life shouldn't.